Did you know that many women are failing to get pregnant because they does not know their ovulation day? And why are they not knowing the ovulation day? It's simply because they does not know the signs and symptoms that are associated with ovulation. In this video, I'm going to talk in details and very deep, explaining to you on what to expect in your body for you to tell that in this particular time I'm on my ovulation. Stay tuned into this video until the end of it. Let's go. Hello viewers, I'm welcoming you again to this video where today I will be talking about the signs and symptoms of ovulation. Because in most cases, majority of women are lacking to get pregnant, not because they have any problem with their reproductive health, but simply because they does not know the signs and symptoms of ovulation, or what are they supposed to expect in their body so that they can tell, today it's my ovulation day. In this video, I will talk in details and I will try to explain to you in a simple language that you can understand on the signs and symptoms of ovulation. I will try to talk about 8 signs and symptoms that are basically common that you can easily tell, and in this case, I begin by spotting. What we mean by spotting, this is a situation whereby there is some drops of blood either in your underwear or even in your pant liner. You just notice there is some few drops of blood, so that is what we mean by spotting. And I want you to differentiate between spotting and bleeding. If it happens you have blood, a blood that you can easily tell this is a blood, then that is not spotting. Spotting simply means there is some drops of blood in your pant liner or your innerwear that in most cases they can even go unnoticed. How does this spotting occur? Remember we said that we have follicles, and inside this follicle, this is where we have an ovary. And for this mature ovary to move from the ovary into the fallopian tube, first thing that must happen, this follicle must break. So this spotting comes after now this follicle has broken, and there is a transit of the ovary from the follicles into the ovum duct. There, in most cases, there are some blood that just comes with it, and they appear to move out of the body through the vagina, and that is how you can easily notice some spotting, and that's all. In other words, that is where we get some spots of blood from. Another sign and another symptom of ovulation is whereby we have some breast tenderness. What we mean by breast tenderness is whereby women experience some slight pain in their breast. Even when you just touch them, they will experience some pain. Even when they are taking shower, when they touch the breast, they will feel there is some slight pain. When also you touch the nipples, there is that pain that they feel that is not usually there. So that is what we mean by breast tenderness. Another symptom is whereby they have an increased in sexual drive. So this is a situation whereby women have that so much desire to have sex, and this is when you are married. This is when a woman can easily tell you that today I am feeling that I need to have sex. This is because they have a lot of desire to have sex. Another sign of ovulation is whereby we have a change in cervical mucus, and this is one of the most common symptoms of ovulation. What we mean by change in cervical mucus, normally the cervical mucus, number one, it is supposed to be thick, and in most cases it's supposed to appear somehow whitish. When you're on your ovulation day, this cervical mucus, number one, changes in thickness. It becomes thin. It also becomes clear. Also resembles the egg yolk, the chicken egg. How that yolk looks like, that is how also the cervical mucus looks like. And when it happens, you touch the mucus and you try to expand your fingers, you will also notice that no matter the length that you have expanded your fingers, the cervical mucus in between will not break. Or when you expand, the cervical mucus will keep on expanding with it. It does not break in between. Remember, when you are not ovulating and it happens, you touch your cervical mucus and you try to expand, it will break. But when you are on your ovulation, when you touch it and try to expand, it keeps on expanding. It does not break in between there. That one is a very clear sign of ovulation. You can easily tell if it happens you have sex that day, you are most likely to score a goal. Another sign is the one by we have change in the cervix. So what we mean by change in the cervix, when you are not ovulating, number one, your cervix is supposed to be closed, and number two, the cervix is supposed to be hand. What we mean by hand, we define it as the tip of the nose. When you touch your nose, you feel the tip of your nose is somehow hand. That is the same way that you are supposed to feel when you touch your cervix and you are not ovulating. Okay, but when you are ovulating, number one, the opening of your cervix becomes very soft. It even goes down a little bit, and it also opens. The essence of it opening, number one, it opens so that it will allow the penetration of the sperms when there is an ejaculation, so that the fertilization will take place. So on knowing on how you can tell the changes in your cervix, you can just try to sit down, or you can just step on the ground, and you can just lift up your leg and touch somewhere higher. Then you can try to penetrate your index finger, and when you touch the tip of your cervix, you will feel your cervix is somehow soft. You will also feel when you try to penetrate your finger, you will also feel it is somehow open, it is somehow soft, and you can also tell that your cervix has appeared, it's somehow down. So that is what we mean by change in the cervix. Another sign is whereby you have nausea and vomiting. Majority of women will present with a feeling of need to vomit, but they does not vomit, which in most cases it is associated with headache. All these changes occurs because of the changes in estrogen and the progesterone level. So when you have these signs, you can easily also tell that you are on your ovulation. Another sign is whereby there is a heightened sense of smell. What we mean by heightened sense of smell, this is the period that women will experience an increased sense of some smells. This is a situation whereby you are just around a woman, then they sense a smell that you yourself cannot even sense. Even if you are female and you are not on your ovulation days, you cannot tell. But if you are with someone who is on ovulation, she can easily tell that there is a smell. And this is the thing that that brings also issues with cravings. So when women are ovulating, in most cases they will also be craving about having some food and or maybe some drinks or anything they can crave over. And this is in most cases when even you will even hear your women telling you need to take shower. Maybe there is a smell of your sweat that I am feeling, and other days she does not complain, but when she is on ovulation, you will be surprised when she tells you need to go and take your shower. So that is because of the increased sense of smell. There is also issues with the pelvic pain. And this is whereby women also present with some pain on just below their ribs and also on the lower abdomen. That comes as a result of changes in the hormones and some expansion of the uterus as it prepares just in case there is an attachment of the fetus. And we also have another sign that is that in most cases it is very hard to tell, that we refer to as the change in basal body temperature. Basal body temperature, this is the temperature that is in your body when you are at rest. In most cases we can easily tell on the body temperature change when you have been checking your temperatures in the morning. Ideally they will not be the same every day, but the changes will be in between 0.5 and up to 1 degree Celsius. But when you are on your ovulation, there might be some changes in temperature that is slightly higher than the readings of other days. So that is also one sign of ovulation that you can easily tell you are ovulating. So all these are the signs that are there, but there are also some women who does not ovulate because of some several factors that I will just try to mention a few of them. Number one, you cannot ovulate if you are on any family planning, and especially the hormonal family planning. Another thing that can result to a woman not being able to ovulate, that is maybe when you are past your menopause age. So when you have reached your menopause, automatically you will not be able to ovulate. There is also a condition that can result to you failing to ovulate, that we refer to as the diminished in ovarian reserve, or in other words, when a woman is born, when a child is born, provided you are feeling during birth, the very first day of your birth, every woman, you are born with the eggs that will spend for the rest of your life. So if it happens that there is that increase or diminishing in the ovarian reserve, you will also present with an ovulation. So those are the things that can even make you not to ovulate. But basically, because our business was to talk about ovulation, so these are the signs that you are most likely to experience when you are on your ovulation. So if you have been checking on getting pregnant, then you need to track during this period. And if you does not want to get pregnant, then you are supposed to avoid unprotected sex during this period of time. Until now we do another video, I will say just bye bye. And if this is the very first time that we are coming across this channel, kindly consider subscribing, hit the notification bell, so that anytime I upload a new video, you will be the very first person to be notified about it. You can also even share the link, and if you have any kind of a question, kindly consider asking it in the comment section, and it will be our joy to help you.